Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, central serous retinopathy. This central serous retinopathy is more commonly seen in idiopathic females, and it is seen in idiopathic young or middle-aged males of around 20 to 40 years of age. So here in central serous retinopathy, actually there will be some dysfunction in the retinal pigment epithelium. Because of the dysfunction in the retinal pigment epithelium, there is some dysfunction in the retinal pigment epithelium, so this epithelium is not normal, right? So there is some dysfunction. As a result, now the fluid from will start accumulating like this into the subretinal space. So this will result in accumulation of fluid into the subretinal space, and whenever the fluid is accumulated in the subretinal space, these are the rest of the neurosensory retina. Now this result in detachment of sensory retina from the neurosensory retina from the retinal pigment epithelium. So this is what occurs. So there is detachment of the sensory retina occurs. This mainly occurs at the macula. So it is central serous retinopathy. So okay, this is serous central retinopathy.
thank you and thank you for watching.